So we'll shift gears now. Look at, we're so close to being exactly on time. I'm really excited about this. So we'll shift right in. As we know, we've discussed some of you are practitioners, some of you are advocates, some of you are survivors or caregivers. One of the next great resources that we have is therapists. And there's nothing better than having a speaker who is not only passionate about this, but also has lived experience. Karen Balumbu Bennett is a licensed psychotherapist specializing in maternal mental health and a wellness advocate who believes in finding balance, something we could all use right now. She's here to break down key statistics, but bust some myths and remind us that storytelling and seeking help are crucial parts of healing. Please join me in welcoming Karen Balumbu Bennett. I feel like I have to fix this.
Okay. Please help me.
Yeah.
I don't know what to do.
It's a slideshow.
There we go. Beautiful. Thank you.
Okay, and I just hit this? Or, oh.
Should be on there.
There we go, the clicker. Okay. Good morning, everyone. Good morning. Yes, okay, so my name is Karen Balumbu Bennett. I am a perinatal mental health therapist in the LA area, and I'm here to just lay our foundation, like Nicole said. But I am preaching to the choir, and I am on a time restraint, so I may go quickly. I'm looking at my timekeeper right here. We have a love-hate relationship. But the great thing about this group is that everyone seems to be somewhat familiar with this topic. So the beautiful experience that we're going to have today is storytelling and the importance of storytelling and the powerful nature of storytelling. And so anyone who's been on the journey to have a child or have children, they have a story. They have their own unique baby journey. And sometimes that baby journey is filled with pain. And so if that baby journey happens to be filled with pain, then there may be some perinatal mental health challenges. And so we're gonna use the definition: a mother or birthing person's overall emotional, social, and mental well-being during preconception, pregnancy, and during the postpartum period to define perinatal mental health. And preconception is very important because it does allow us to encompass our individuals who are maybe struggling to get pregnant and maybe those who have some recurrent pregnancy losses. I also just want to highlight that we are now using the term perinatal to really encompass the whole baby journey again, and not just postpartum, which a lot of us were really familiar with hearing for the majority of our lives, like postpartum depression, postpartum care. But we really want to focus on the entire journey because we know that women and birthing people can have challenges during that entire time. So the World Health Organization defines healthy maternal perinatal mental health as a state of well-being in which a mother realizes her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to her community. And so we're here, though, to really focus on the challenging part, right? So we want everyone to have a healthy maternal or perinatal experience, but we know that that is not the case. And so just to give us a little bit more background, and the amazing speakers before me really highlighted a lot of this. So again, I'll try to zoom through some of it. But it is, again, the most common complication of pregnancy and childbirth. We now use perinatal mood and anxiety disorder, or PMADS, because for so long we just focused on depression, but we realize now that there are mood disorders that can come about and anxiety disorders as well. And changes in biology, psychology, and environment can contribute to mental health challenges during this time frame. Again, some of this information, or all of this information was, oh, I love this. All this information was already mentioned, so let's just go quickly through it. Again, mental health conditions are the leading cause of maternal deaths. About 1 in 5 women or birthing people will experience PMADS, so that's about 20%, and that number is changing. About 75% will go untreated, and that's maybe because of lack of access, but also we have to talk about just that stigma, the shame, the guilt, the fear. If I report this, will my child be taken away from me? There are so many reasons why it can go untreated. And again, Black women are 2 times more likely to experience a perinatal mood and anxiety disorder. And it has a lot to do with institutionalized racism, lack of access, lack of cultural competency, and so forth. So just a little quick breakdown. Perinatal mood and anxiety disorders, again, encompasses depression, anxiety, post-traumatic stress disorder. So let's think about those who maybe had a difficult pregnancy already, a difficult or traumatic birthing experience, some losses. They may be coming into another pregnancy with some trauma. Perinatal obsessive compulsive disorder, which can be very distressing, characterized by a lot of recurrent thoughts, checking, worrying. Perinatal bipolar disorder. So those who already have a diagnosis of bipolar disorder, there's a 50% chance that they will experience some challenges. So we really want to give them support. And like mentioned earlier, perinatal psychosis, which is very rare, it is a medical emergency, and you want to get help immediately. Oftentimes, these symptoms present themselves within the first month of after you give birth. And so if you are recognizing that someone you care about is struggling with maybe some hallucinations, some delusion, just some breaks from reality, you really want to get them help immediately. And as mentioned, I think either Deb or Cassie mentioned that there are several risk factors. We will zoom through this, but under physical, we always talk about lack of sleep, and all of the birth workers in here, that is like the #1 prescription, right? Mom, get rest, which could be very frustrating to a mom with a newborn. Like, how am I going to get rest? And that's where we talk a lot about that village and community care, because you can't really rest if you don't have support. Under social and societal, I like to highlight the societal pressures. There's so many myths that surround parenthood and motherhood. It's going to just come naturally. You're going to bond right away. The snapback culture, geez, the snapback culture, right? All the pressure to look and feel the way you felt before you had a baby. And all of that can cause a lot of stress, and that could be a risk factor as well. And then fertility challenges. So for myself, I like to highlight this because I struggled with fertility challenges. I struggled for years to get pregnant. I struggled with pregnancy loss, used IVF to get pregnant, had a very high-risk pregnancy because of fibroids, had a very traumatic birthing experience because of vacuum-assisted care. And then I had a baby. Of course I was anxious. I was like, how was I not supposed to be anxious? And I was worried, and I didn't even realize it. And I shared the story that I remember one time, I had my daughter right before the COVID shutdown, and I remember one of my friends was like, well, let's get some help for you. You know, like, you guys are working, let's get someone in here. And I looked at her and said, I live in a building. I said, well, what if they throw my baby over the balcony? And her face just changed. And all that time, I was just holding this thought, and I really thought it was just a common thought, like no one else thinks this. And I really had no clue that I was really struggling with fertility challenges. And so, I'm sorry, with anxiety. And so I share this because myself as a therapist, right, sometimes oftentimes actually, we overlook our own struggles. Okay, so see my timekeeper here. High-risk groups. So anyone, again, can struggle with fertility challenges. Like we heard, it crosses cultural barriers, race, ethnicity, socioeconomic statuses, but obviously there's always people who are more at risk. And here is a list of some of our at-risk groups. And this could be because of racism, prejudices, lack of access, judgment, so forth. I also always want to give special consideration to our non-birthing parents. About 10% of fathers or non-birthing parents will experience a perinatal mood and anxiety disorder, and that number does increase if the partner is experiencing a perinatal mood and anxiety disorder. Adoptive parents can also experience PMADs. And again, I also always want to just throw in for special considerations Black women and Black birthing people, because as we heard by every speaker that came up here before me, that they are at high risk. So of course with that, there are protective factors, and California has some assembly bills that do require personnel to screen for PMADs and to provide education and resources to families. Some other protective factors I listed in here. I want to always shout out doulas, to all the doulas in the room. You all are my favorite people. I had an amazing doula. Doulas empower you, they support you, they can advocate, they educate. Doulas are amazing, and I wish every birthing person can have a doula. And so that is a huge protective factor, and also just having good support. So with support comes interventions, right? So we talked about risk factors, protective factors, but then there's intervention. So what if you find yourself in this place? So therapy and psychiatric care. Also just, again, I always say there's no self-care in motherhood if there's no community care. We can't do it alone. Women can't do it alone. So they need a village and they need a support system. And again, with storytelling, group therapy, and peer-based support groups, like Dev mentioned, are very powerful. It allows you to tell your story. Close something. Okay. Okay, now I can't go forward anymore, and I don't know what happened.
Sorry.
No problem.
It should just be. There you
There
go.
we go. Okay. So really quickly, because my time is up. You have a time's up? Oh my gosh. Okay. Oh my gosh. Okay, so I always like to leave this last slide when I do speak when I have more time to speak. I like to really emphasize ways that you can support people, because sometimes we're like, well, what do I say? Toxic positivity. I want to make sure I'm not saying anything that's harmful. And so here's some things that you can say. I highlight at the very bottom just that I'm here to listen, because that does allow individuals to share their story. And that's what we're here for, right? So I just want to encourage everyone in this room, whether you're here just to listen, but to also reflect on your own story. And this may be a great time for you to start to reflect. There is so much power in sharing your story. You can start with just journaling, right? Just externalizing what you've experienced if you're not ready to share yet. Thank you so much.
Keep it going for Karen. That was amazing. Thank you. I did love her last slide, number 1, when she said, I'm going to be at your house on Tuesday at 4 for cleaning. So thank you, Karen. Getting so much out of this. All right, moving right along, very excited to introduce you to our next speaker. He is a medical doctor, Rohit Passy, to continue setting context and understanding around perinatal mental health. As Chief of Neonatal Perinatal Medicine and Director of Equity, Inclusion, and Diversity at Kaiser Permanente, South Bay, Dr. Passy brings a wealth of professional expertise as well as his own personal experiences as a parent and a clinician. He will go deeper into the disproportionate impact of perinatal mental health on minority communities and share why cultural humility in healthcare is critical for achieving true health equality. Please join me in giving a very warm welcome to Dr. Rohit Passy.
Thank you, everyone. Hello. Thank you for having me here today. So excited to speak. I'm here to provide a perspective from a healthcare provider, a physician, a parent, and also the minority males that we are here who can act as an ally to this cause. A little bit about myself. I think that's very important to, my story is important to understand why I choose this work and what I do. I'm an immigrant. I grew up in India. I came to United States without any support. I literally came to this country with $200 in my pocket, and it's been a long journey. English was, in fact, the 4th language I learned speaking. So if I say something or mess up, I can always use that excuse. English is my first language. I was very lucky to really learn from Black leaders in medicine from early on in my career. I did my residency in Harlem, New York, and really got exposed to the issues around health equity, especially for Black and migrant communities early on. That has really shaped my career. And then I went on and joined Kaiser Permanente about 8 years ago. And honestly, I'd started thinking being an immigrant and all those struggles, and working in Harlem has taught me a lot about health equity and inclusion. But that was all, but the biggest lessons I learned in inclusion and equity was when I became a parent. There were so many misconceptions I had about life and medicine and about maternal health until I got to experience some of those during that process with my wife. I'll give you an example. I was always judgmental about breastfeeding, right?